So on to some of the perhaps very familiar to you issues around sources of information on violence, mortality, and morbidity. In estimating these, there are many potential sources, including vital registration systems, sample registration systems, population surveys and censuses using verbal autopsy, media reports and hospital databases. I'm going to focus, however, on vital and sample registration systems and population surveys, the three methods that seem to hold the most promise for improving our ability to measure deaths due to violence. And I could say, indeed, non-fatal instances of violence and victimization and perpetration. Increasingly, there are surveys of perpetration of violence, especially of sexual violence. For instance, some work that has been recently done in South Africa, extremely revealing of the prevalence of the perpetration of rape by males that were interviewed, and their willingness to answer is quite surprising. Similarly so with child maltreatment. I don't know what it tells us about people, but anyway. Well, it tells us a lot about people, but it's quite remarkable. So on to the vital registration. The WHO mortality database is composed of information that is sent to WHO by member states, and that information consists of year-on-year information from their vital statistics about the causes of death. And this mortality database is a reasonably good indicator of the number of countries that implement vital registration and the quality of the data they produce. All of the stuff I'm talking about is available online at WHO in the WHO Statistical Information System. It's easy to get to from the WHO website. So what's the first thing we see when we go into the WHO mortality database? And it is that there's a huge skewing in the number of countries by WHO region that actually return information to WHO. So for instance, taking the period 2002-2007, just 9% of countries in the African region reported such data. And these countries included places like Mauritius and the Seychelles. Just 19% of countries in the Eastern Mediterranean region versus 90% of countries in the Americas and Europe. If you look at the reporting countries by income, half are developed, and these account for 75% of deaths in the database. So that tells us that the WHO mortality database is a pretty bad source of information about the causes of death in countries that are probably most affected. And we can see that when we compare the reported deaths versus estimated deaths, as this chart does. So you can see in some of the regions with the highest estimated deaths, you have the lowest proportion of countries, or number of countries, that are reporting deaths or causes of death. Let me now illustrate some of the issues around estimating deaths due to interpersonal violence now, using vital registration data. Homicide rates are one of the most basic indicators of interpersonal violence, yet for 40% of the countries that do report vital registration data, the coverage is under 90% of all deaths, and therefore the homicide counts aren't representative. Injury causes, especially homicide and suicide, may also be underreported due to legal problems and insurance concerns. And some countries, therefore, perhaps therefore, classify a very high proportion of injury deaths as due to undetermined intent. An illustration of that is from the South African vital statistics for 1996. That actually haven't changed too much in 13 years. In 1996, 93% of the injury deaths in the vital registration system were coded as ill-defined as to intent. So they couldn't say whether it was a homicide, suicide, unintentional injury, or undetermined. 93%. However, it was relatively easy in South Africa to unpack this dark figure using a mortuary-based sample registration system, and that revealed what the pie with the pink slice in it shows, which is that about 45% of those deaths were homicides, followed by road traffic injuries. So that's one illustration of how you might use a sample registration system to unpack this dark figure. And I know that Robert in Tonga is doing something similar in Zambia, and that we've certainly worked with a group in Maputo to do the same, at least for Maputo city causes of death, which has been very insightful and revealing. Going now to a situation where vital registration systems do have representative coverage, their sensitivity to homicide deaths seems to be reasonably high, and you can see that from this slide showing how the all-injury death rates in 4 Eastern European countries spiked in the mid-1980s around the time of the Soviet Union's collapse, perhaps reflecting suddenly increased access to alcohol, drugs, and guns. That's the hypothesis here, especially the alcohol and the guns in relation to homicide. Where vital registration systems do exist and are maintained through periods of conflict, there may be of value in providing one measure of conflict deaths that can be triangulated with measures from other sources, and I'll illustrate that now. Here's the situation for Chile, where vital registration recorded an excess of around 2,000 injury deaths during the 1973 revolution, versus the 8,000 war deaths estimated by the Correlates of War project. In Croatia, the Balkans War led to an excess of 5,000 deaths when measured by vital registration data in the country, versus 1,600 deaths estimated by CRED, which Debbie is not here at this point. But there's another point where you could triangulate these different data sources. In Guatemala, vital registration systems suggested an excess of 12,000 deaths in the 1976 earthquake versus 23,000 estimated by CRED, and an estimated 12,000 in the violence of 1980 versus 6,000 estimated by the American Association for the Advancement of Science. So once again, I think this is really pointing to the value of triangulation. It's not a question of which one is better, but they're pointing in the direction of, we know the story. We've got a range, we've got 2 systems that are suggesting similar things. Unfortunately, as we all know, in addition to the fact that many countries most affected by war lack vital registration systems at all, where such systems are in place, they usually break down during war, and missing data are common, as you can see here for the 4 countries in this slide, or the 3 countries shown here: Bosnia and Herzegovina, Colombia, and El Salvador. So during the conflict, you have big gaps in the data, and we are left to imagine what might be there.